Part A. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you in?
Good morning, Dr. Wright. I'm not really sure where to start. I've just been feeling off lately. Like, I'm eating a lot more than I normally do. And it's not just normal, it's like I can't stop once I start, you know?
You've been eating more. Can you explain a bit more?
Well, it's both, actually. I mean, I'm having larger meals, but it's mostly that I'm having constantly throughout the day. It's really strange because I never used to eat like this. I don't even feel that hungry most of the time, but I just eat. It's almost like I can't help it.
I see. And when did this start happening? Has there been any specific trigger or event that you think might have caused it?
Well, it's hard to say. Maybe about 2 or 3 months ago. At first, I didn't really notice anything out of the ordinary, but it's gotten worse lately. I just find myself snacking even when I'm full. Like last night, I had dinner, I felt full, but then an hour later, I was eating again. I don't know if it's stress or something. I've had a lot going on.
That does sound concerning. And apart from eating more, have you noticed any other symptoms, maybe changes in weight, digestion, mood, or anything unusual?
Oh yes, I've definitely gained weight. I'm always feeling bloated, and sometimes I have this discomfort in my stomach. I also feel sluggish, like I'm tired all the time, but it's a different kind of tired, you know? Doctor, I've been feeling quite down lately. I thought it was just stress, but sometimes I wonder if it's more than that. But then again, maybe it's just because I'm constantly overeating. And one more thing, it's like mentally, I just don't have energy. But physically, I'm also fatigued.
So you're experiencing physical symptoms, along with changes in your mood, which could indicate something more. And no significant changes in your routine recently?
Well, I mean, my work is always stressful, but nothing unusual. And my sleep, that's been bad too. I either can't fall asleep, or I wake up in the middle of the night, thinking about random things. It's like my mind won't shut off, you know? But yeah, my lifestyle hasn't really changed much.
Okay, I see. Now Mihiraa, just to clarify, is there any particular time of day when these symptoms are worse?
I think it's worse in the evening, especially after work. I think I just feel more, I don't know, unsettled in the evening. That's when I really crave food, even though I know I shouldn't be eating so much. But during the day, I'm still snacking here and there.
It sounds like there could be some emotional aspects to this, maybe emotional eating. That's when people tend to eat not because they're physically hungry but because of their stress, boredom, or sadness. Have you ever considered that?
I've thought about it, but I don't know. I mean, maybe. But the thing is, I don't always feel anything when I'm eating, or maybe I do, and I just don't realize it. I'm not sure.
That's understandable. These things aren't always obvious. Have you tried anything to manage it yourself? Any treatments or remedies at home?
Oh yes. I've tried a bunch of things. I've tried eating smaller meals, but it just doesn't work. I still feel the need to snack. I've also tried drinking more water to feel full, but that hasn't helped either. I even tried some mixed fruit juice that is supposed to reduce appetite, but honestly, nothing seems to make a difference. I'm still doing it, even when I tell myself not to.
It sounds like you've already tried quite a few strategies without much success. And what about your family? Is there any family history of similar issues, whether with eating, emotional health, or anything like that?
Well, actually, now that you mention it, my mother always struggled with her weight, and she did have some issues with binge eating. But I don't think she ever really got any help for it. She just kind of dealt with it on her own.
That's good to know. Family history can sometimes give us clues. Given your symptoms and what you've tried, I think we might need to look at this more holistically. For now, I'd like to refer you to a psychiatrist who specializes in behavioral therapy. They might be able to help you address the underlying triggers. Would you be open to that?
Okay, I guess I could give that a try. Is there anything else I should be doing in the meantime?
Well, aside from therapy, I'd recommend keeping a food diary for now. It could help us, and you, see if there's a pattern.
Yeah, that makes sense. Thank you, doctor.
You're very welcome, Mihiraa.
Extract 2. Questions 13 to 24. You hear a pulmonologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mihiraa. I'm Dr. Alfred Chris, a pulmonologist. What brings you in today?
Good morning, doctor. I've been having some trouble breathing for the past few days, and it's getting worse. I feel like I can't take a full breath. Sometimes I get these sharp pains in my chest, especially when I try to breathe deeply or move around.
I see. That sounds concerning. Can you tell me more about when these symptoms?
It started about a week ago, maybe more. At first, it was just mild discomfort, but now it feels like I'm gasping for air sometimes, and the pain is almost constant. It's particularly bad when I lie down. I've also been feeling more tired than usual. I'm really scared that it could be something serious. It started about a week ago, maybe more. At first, it was just mild discomfort, but now it feels like I'm gasping for air sometimes, and the pain is almost constant. It's particularly bad when I lie down. I've also been feeling more tired than usual. I'm really scared that it could be something serious.
I understand how stressful that must be, Mihiraa. Have you noticed any other symptoms, like coughing or a fever?
No fever, but there's some coughing, although it's not frequent or severe. It's more of a dry cough. I thought it might just be a cold at first, but when my breathing didn't improve, I started to worry.
Have you tried any treatments or medications to relieve these symptoms?
Yes, I initially took some over-the-counter painkillers that helped a little, but the relief didn't last long. I also tried using an inhaler that my GP prescribed a few months ago for mild asthma symptoms, but it hasn't made any difference this time. I even tried steam inhalation at home, thinking it might help with the chest tightness, but nothing seems to work.
I see. So, you've had some asthma issues in the past. Can you tell me a bit more about your medical history, Mihiraa?
Well, I was diagnosed with mild asthma about a year ago, but it's usually pretty well controlled. I only get shortness of breath occasionally, like when I'm exercising or during cold weather. Aside from that, I've had no major health issues. I've never had anything like this before, though, this constant chest pain and difficulty breathing.
Thank you for sharing that. Based on what you've described, I'd like to investigate further. Your symptoms and a history of asthma can point to a few conditions. One possibility that I'm concerned about is a pneumothorax.
That sounds really serious. What causes that?
It can be caused by various factors, including lung diseases like asthma or COPD, or sometimes even a physical injury to the chest. However, spontaneously it can also happen without any clear cause. It's when air leaks into the space between the lung and chest wall, putting pressure on the lung and making it difficult to expand fully. This could explain your symptoms.
Oh my. Is it dangerous?
It can be serious, but with the right treatment, most cases are manageable. To confirm this diagnosis, I'll need to order a chest X-ray, which should give us a clear image of your lungs. In some cases, we might also do a CT scan to get a more detailed look if necessary.
Okay, I understand. How is it treated?
Treatment depends on the severity. For a minor one, sometimes the air can be reabsorbed by the body on its own, and we can manage it with oxygen therapy and rest. But in more significant cases, we might need to remove the air manually. This can be done by inserting a chest tube into the chest to relieve the pressure and allow the lung to re-expand. It's a simple procedure, but it must be done carefully.
That sounds scary. It sounds like I have a lot to think about.
Mihiraa, let's start with the test, and we'll go from there.
That is the end of Part A. Now look at Part B.